get into the details of the sweeping new reporting from the New York Times, from intelligence agencies to cabinet department experts to top White House advisors. The paper's examination found, quote, the president was warned about the potential for a pandemic, but that internal divisions, lack of planning, and his faith in his own instincts led to a halting response. In short, Trump was warned by, quote, the very people in his government whose expertise and long experience might have guided him more quickly towards steps that would slow the virus and likely save lives. The paper begins in early January. Deputy National Security Advisor Matthew Pottinger was rattled by a call with a Hong Kong epidemiologist who bluntly warned him a ferocious new outbreak had emerged in China. It had spread far more quickly than the government was admitting to, and it wouldn't be long before it reached other parts of the world. It was one of the earliest warnings to the White House, and it echoed the intelligence reports making their way to the National Security Council. The more specialized corners of the intelligence world were producing sophisticated and chilling warnings. At the same time, the paper reports, in a report to the Director of National Intelligence, the State Department's epidemiologist wrote in early January that the virus was likely to spread across the globe and warned that the coronavirus could develop into a pandemic. Working independently, a small outpost of the Defense Intelligence Agency, the National Center for Medical Intelligence, came to the same conclusion. Within weeks after getting initial information about the virus early in the year, biodefense experts inside the National Security Council, looking at what was happening in Wuhan, started urging officials to think about what would be needed to quarantine a city the size of Chicago. But even as HHS Secretary Alex Azar first briefed the president on the potential seriousness of the virus during a January 18th phone call, Trump projected confidence.
Are there words about a pandemic at this point?
No, we're not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
January 27th, a National Security Council meeting in the Situation Room was jolted when Stephen E. Biegun, the newly installed Deputy Secretary of State, announced plans to issue a Level 4 travel warning, strongly discouraging Americans from traveling to China. The room erupted into bickering. In late January, the president was told at the time about a January 29th memo produced by his trade advisor, Peter Navarro, laying out in striking detail the potential risks of a coronavirus pandemic, as many as 500,000 deaths and trillions of dollars in economic losses. Trump denied ever seeing it.
Did you see these memos that reportedly Peter Navarro wrote back in January? When did you see them, and how does these memos sort of square with what you've often said, that nobody could have predicted this? It sounds like he was predicting it.
I didn't see him, but I heard he wrote some memos talking about pandemic.
Yeah, he said I never read them. January 30th, then acting White House Chief of Staff Mick Mulvaney and Secretary Azar called Trump aboard Air Force One as the president was making the final decision to go ahead with the restrictions on China travel. Azar was blunt, warning that a virus could develop into a pandemic and arguing that China should be criticized for failing to be transparent. Stop panicking, Mr. Trump told him. January 31st, the limits on travel from China were publicly announced. But the Times found that nearly 40,000 Americans and authorized travelers have come into the U.S. from China since Trump imposed those restrictions. February 13th, Secretary Azar announced a plan to repurpose a flu surveillance system in 5 major cities to help track the virus among the general population. The effort all but collapsed even before it got started, as Mr. Azar struggled to win approval for $100 million in funding, and the CDC failed to make reliable tests available. February 21st, the White House Coronavirus Task Force gathered. Among the questions on the agenda, when should it be recommended that Trump take textbook mitigation measures, such as school closings and cancellations of mass gatherings? The group concluded they would soon need to move forward with aggressive social distancing, even at the risk of severe disruption to the nation's economy and the daily lives of millions of Americans. February 23rd. Dr. Robert Kadlec, the top disaster response official at the HHS, came across an email from a researcher at Georgia Tech regarding a Chinese woman who infected 5 relatives with the virus, even though she never displayed any symptoms herself. Is this true? Kadlec wrote back. If so, we have a huge hole on our screening and quarantine effort. The blunt reply: people are carrying the virus everywhere. The very next day, Dr. Kadlec, the top disaster response official at HHS, along with the rest of the task force, decided to present Mr. Trump with a plan titled 4 Steps to Mitigation, telling the president that they needed to begin preparing Americans for a step rarely taken in United States history. But the next several days, a presidential blow-up and internal turf fights would sidetrack such a move. By the 3rd week in February, the administration's top public health experts concluded they should recommend to Mr. Trump a new approach that would include warning the American people of the risks and urging steps like social distancing and staying home from work. But the White House focused instead on messaging, and crucial additional weeks went by before their views were reluctantly accepted by the president, the time the virus spread largely unimpeded. March 16th, even as Trump announced 2 weeks of new social distancing guidelines, the subsequent economic disruptions were so severe that the president repeatedly suggested that he wanted to lift even those temporary restrictions. He frequently asked aides why his administration was still being blamed in news coverage for the widespread failures involving testing, insisting the responsibility had shifted to the states. Wow. Let's bring in investigative reporter with the New York Times, who is one of the few reporters on this expansive piece. A lot of different sources and a lot of different folks working on this. Thank you so much for joining us. We're really appreciating this reporting. It is so step by step by step by step. It lays out the many different warnings.
So, Eric, thank you. Eric Lipton, thank you for being with us, New York Times. I guess the takeaway is you look and you see that the National Security Council, especially Matthew Pottinger, very concerned, the State Department, the Pentagon, the National Security Council, as I said before, of course, the CDC, the HHS, all of these agencies and the Trump administration knew about what was going on in China and were fearful that a full-blown pandemic could explode. And that was in early January. What did your reporting find the biggest obstacle was from them being able to turn those fears and concerns of the coming pandemic in early January into policy that could have saved so many Americans' lives?
I think that there's a lot that happened here that sort of tells us about the Trump administration, things that we've known for several years now, but we haven't had a crisis that was going to test this administration in the way that this has. And the inability to make a decision, the disagreements among key members of the White House staff, the fact that you had a chief of staff who was on the way out and was unable to, have the respect of his colleagues and make decisive choices to advise the president, and a Secretary of Health and Human Services who also did not have the full respect of the president, and disagreements among the economic team and the health team that really almost, that left a lack of a clear consensus as to what choice the president should make. But really, all this goes back to 2006 and the Bush administration, when leaders in the Bush administration realized that it was just a matter of time before there was going to be a pandemic that was going to threaten the United States. And they prepared this plan, which laid out in a very prescriptive way the steps that would need to be taken And there's really two stages, and the stages are, it's very simple. I mean, it's simple, you know, on its face: containment and mitigation. And containment is when you can actually limit the threat from coming into the United States. And if it does come, you do these contact tracing in which you identify people who were infected by the individuals who have the virus, and you isolate them. But there's a certain point when containment, you lose the ability to contain it. And you go to what's then called mitigation. And mitigation is when you do social distancing, you close businesses, you close schools, and you do it only in targeted parts of the United States where it occurs. You don't do it across the United States at once. The biggest thing that happened here was that the President of the United States was convinced. This is a guy who feels that he can control borders, that he's got the powers, you know, extraordinary powers around the borders, that he thought that he could contain this virus, and they waited weeks too long to move to mitigation. And that's what Fauci was talking about. When do you go from containment to mitigation? The scientists know that you have basically 2 weeks from the point of your first death or a certain number of cases of the virus confirmed in a community to switch to mitigation. And if you don't do it, you will have many, many deaths in that community. It's a prescription. And they sat and waited. And now, of course, it's the governor's choices as to when to shut down schools and businesses. But the doctors who work in these federal agencies told me that they need a leader in the federal government to take the flack and to say it's time to close the schools and businesses in this location. Again, it didn't need to be a national call. It needed to be in hot spots. And they needed the cover from a federal official, from a surgeon general, from a president, from someone at NIH or the CDC. Because the governors are in a difficult place.
Right. Well, so help me out as far as the communication inside the White House goes. So in early January, looking at your article, the National Security Council, the State Department, the Defense Intelligence Agency, the Pentagon, the CDC, Department of Health and Human Services, the intel community, everybody knew about this. The president was getting it in his daily briefings, starting most likely, I guess, around January 6th or so. And yet the first we hear of anybody communicating with the president verbally by phone was Alex Azar on the 18th of January. Was that the first time the president would take anybody's call on the coronavirus, or had he spoken with anybody before that?
I mean, that's hard to know for sure. That's the first time that we're aware of. But there's no question that the people in the national security staff were discussing this from early January and probably late in late December. And as to when the first explicit conversation is, that's the date that we have. And I mean, in January, it was a matter of this is a pandemic. It was spreading at an incredibly rapid rate. It was essentially all but certain it was going to come to the United States, and there was going to be spread in the United States. The real question, in my mind, for January is at that point, they knew that they were going to have shortages of PPE, mask, and they knew that there was going to be hospital bed shortages that were likely going to occur. They knew that that ventilators, they could have been thinking about ventilators. They could have started the acquisition process in January for personal protective equipment. That was a critical thing they could have done. What's the status of our supply chain? How sufficient is the stockpile? Those are things that they waited until March to really get started on. They didn't make any significant orders until March. And that's a long time to have not. Now, at that point in January, they did not know how wide the spread would be in the United States, but it was essentially a foregone conclusion that there was this was coming to the United States and people were going to be sick and some people were going to die.
All right, Eric Lipton, thank you very, very much for your extensive reporting.
What an important article.
When
Thank
you read
so
about
much.
the bickering.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.